You're pregnant.
Congratulations. Now what? Many of you are buying clothes, picking names, and making preparations around the house. But are you making preparations to your body? Prenatal care is a core factor in having a healthy baby. This means going to regular doctor visits and health screenings, among other things. But for some women in Florida, this actually proves to be harder than it sounds. More than 3 million women in Florida are living below the poverty line. For these women, it's a lot harder to acquire health benefits, and they rely on public health assistance for prenatal care. Unfortunately, the amount of public health department clinics that provide pregnancy care has been reduced by 58% in Florida, leaving only 28 of Florida's 67 counties providing prenatal care through the health department. So, what options do these women have? Sure, they can go to either a public or private hospital. But roughly only 1/3 of private hospitals accept Medicaid in Florida. And public hospitals have copay that can either be challenging and sometimes even unrealistic for these women to meet. Not only is it difficult for this population to get prenatal care, they are also at higher risks for obesity, hypertension, diabetes, and dangerous environmental toxins, which can negatively impact the baby. Being overweight and underweight while pregnant can cause prematurity, which is linked to developmental delays and lower IQ. While diabetes, environmental toxins, alcohol usage, and smoking has been correlated as a cause of intellectual disability and of many other developmental issues. With monitoring during pregnancy, we can eliminate many of the risks that harm the child. In return, we can have less babies in the NICU, less children with intellectual disability, and less children with developmental delays. Let's create a healthier future for our children and be proactive instead of reactive. Know what's happening in your local county and state, and let's make a difference. Let your voice be heard.